A CDC advisory panel has recommended the use of Pfizer's COVID-19 vaccine in children ages 12 to 15 years old. Now the CDC director must formally sign it.
CBS 2's Alice Gaynor is live at the Javits Center vaccination site with more on what this means. Alice.
Dick and Christine, once this is signed, beginning tomorrow, you can get your 12 to 15-year-old a COVID-19 Pfizer vaccine at any of the more than 250 sites in the city that offer the Pfizer vaccine. Still, not every parent is on board, so there are efforts underway to change all of that, especially with in-person learning, sports, and other activities resuming.
The motion passes.
Children ages 12 to 15 will soon be able to get the same two-dose Pfizer COVID-19 vaccine as adults.
I would have them vaccinated as soon as possible.
According to the CDC, about half of parents surveyed say they will vaccinate their children. The most common reasons others won't:
not being sure it's safe or that the vaccine was developed too quickly.
During the CDC's Advisory Committee on Immunization Practices public meeting Wednesday, they presented evidence to show that the benefits of the Pfizer COVID-19 vaccine outweigh any bad.
For all persons aged 12 to 15 years, there were 0 cases among 1,001 persons in the vaccine arm and 16 cases among 972 persons in the placebo arm, which resulted in a vaccine efficacy estimate of 100%.
They say to date there have been over 1.5 million reported cases and 13,000 hospitalizations among kids 12 to 17 and 127 COVID deaths for that age group.
While this sounds low, it's worth noting that this would still be in the top 10 causes of deaths among children in 2019, which is the last year that we have top 10 causes of death for comparison.
Another reason to vaccinate kids:
protect others around them.
The CDC says adults living with a child in full-time in-person school was associated with a higher risk for COVID-19-like illness. Here in New York City, they want to get all parents on board.
Actively working with community pediatricians and the Department of Education, who will be critical to both administering the vaccine as well as communicating with parents and guardians about its safety.
The health department says it has allocated vaccines to all providers who requested an order, so talk to your pediatrician. The CDC says when it comes to side effects for younger teens, it's pretty much the same as it is for adults when you get the vaccine. It could be a sore arm, fever, chills, that sort of thing. We're live at the Javits Center. Alice Gaynor, CBS 2 News.
All right, Alice, thanks very much.